Hi, my question goes to the physician.
What is the dentist advice on the way forward?
I wanted to know what are some of the treatment options for cervical cancer.
A very good afternoon to you. You're right on time for this week's edition of Doctors on Call. Now, I've been doing this show for a very long time now. Not that I'm leaving, but it has taught me one thing. Creating awareness always goes a long way. And from this, I've covered known topics, known conditions and diseases, some which are not that well known about, but others are simply unheard of. And this afternoon on Doctors on Call, our focus is on one particular condition, which if I mention the word, probably it might not ring a bell, but we have people affected by this particular condition. I'm talking about lupus, and this for this edition on Doctors on Call, this is our focus as we try and create awareness as far as this particular condition is concerned. So the next question that you might be asking yourself now, what is this lupus? And what does it mean if you have lupus? Is it something that you can treat or you have to know how to manage? Well, these are some of the questions that we're going to be addressing on this particular edition of Doctors on Call, and we are coming to you live on Family TV, Family Radio 316. I can see we are also streaming on our Facebook pages. That's Family TV and Family Radio 316. Not forgetting our website, which is www.familymedia.tv. Now, you're used to seeing doctors on the show, but today I mentioned it's a special edition and we're doing things a little bit differently. I might be assuming, do I have any doctor on set?
No, we don't.
All right. Yeah. So I'm looking forward to hosting one doctor who's going to be taking us through what exactly this condition is. But just before that, these two amazing ladies will be sharing on their struggle with this particular condition. You can just start by introduction. You can say your name and probably what you do.
Washera Maina, lupus warrior for the last 29 years.
29?
Yes, 29. And I'm a business lady. Yes.
All right. I'm also a businessman. And for you, my dear?
I'm Kanja Mwingera. My star doesn't shine as much. I was just diagnosed in 2015, so this is my third year. I am a business lady as well, but I'm also a student.
Okay.
Yes.
All right. Something that you mentioned, very interesting, is you've been a lupus warrior for 29 years. Yes. Does it mean that the diagnosis was made 29 years ago?
Yeah, when I was, the symptoms started when I was 9 years. I was in class 4 then. But the diagnosis was done when I was 11 years. Because then there was no doctor who could understand what was happening to me.
Okay.
It started with joint pains. My joints would swell, get red, and then I had recurring sore throats and very high fevers. So the doctors would just put me on painkillers and antibiotics. So that was the trend until 2011 when I came across a pediatrician at Kenyatta National Hospital who diagnosed me with lupus.
With these symptoms or signs like the joint pain, were they on and off or were they constantly throughout?
For me, they were constant. Yes.
All right. Is this the same case for you? I know for you as the diagnosis was made 2015, but prior to that, did you notice anything being off?
I would say no. I've had a pretty normal life. So when 2015 January is when I started getting unwell, and I remember I was always tired. That was my first symptom. I was always tired, and then the joint pains followed, and then one day I remember I couldn't get out of bed, and that's when I realized maybe this could be something serious. Then after that, maybe as the months progressed, I started getting infection after infection after infection after infection. And actually, Washera had been my friend since 2008, is it?
You guys go way back.
We go way back.
Yeah.
So I remembered, that's when I remembered Washera and her story. And I thought, she's always complaining of joint pains and fatigue. And these are my two major symptoms. And she's always in hospital. So I just thought, let me just call her and talk to her. In fact, I wasn't calling her to ask her for a doctor or, anything of the sort. So when I called her and told her how I'm feeling, Oshara panicked. Because in her heart, I think she knew this is definitely lupus. So that's when she directed me to a doctor, and the rest has been fairly okay. But I'd say I stayed with symptoms for about 8 months before I was properly diagnosed.
With these 8 months, how are you managing this particular condition?
Woo. I was in hospital every week. That's what I remember. Because I would get UTIs. The next week it would be my chest. The next week I would have joint pain. When I go to hospital, they'd tell me I have malaria. The next week, my eyes. The next week I have recurrent headaches. I was in hospital every single week. And I remember it got to a point I started Googling. So I went to an anesthetist doctor. Could what I have be arthritis of some kind? And the doctor just told me, no, it can't be. You're too young. And, well, clearly I proved him wrong. Yeah.
You mentioned that before getting the right diagnosis, you had to see several doctors.
Yes.
What was the reasoning behind this? And also for you, did you get a case of misdiagnosis here and there?
Oh, yes.
Yeah.
I was treated for malaria, URTI, that's upper respiratory tract infection. Mostly they were treating the symptoms. So, because I was young, I was seeing pediatricians. So it was just painkillers. No doctor seemed to understand. At one point, I remember I was taking about 16 aspirins in a day.
Based on that, did you have any other issues with any other body organ of yours?
No.
Due to the misdiagnosis?
No, thank God, no.
Okay.
Yeah.
Now, let me just take you back. With that fatigue, is it after strenuous exercise?
Oh, no.
Or you just wake up and you just feel tired?
You wake up and you're tired. Like, you wake up at 8 a.m. and your body just, it's like you were playing football the whole night. Or like you were wrestling with somebody in bed the whole night. So you tell yourself, oh, let me get some rest. Oh, let me try to take it easy. You take it easy. You try to pamper yourself. You're still tired. I don't know how to explain that fatigue. I really don't know how to explain that fatigue. But you're constantly tired.
Okay.
Yeah.
Because I know maybe for you, Ashera, I can tell for a fact, I can imagine you are 11 years old.
Yeah.
At any given point, were you told that it could be arthritis because of the joint pains?
No.
Okay.
No. Actually, I didn't understand much. And I remember at one point, my dad was told we need to admit her so that we can do more tests. And I loved school so much. So when he told me you'll not go to school for about a week, I could not understand why. So it was hard. I could not understand. Even lupus, I came to understand it much later when I turned maybe 12, 13. Yeah. Yes.
How was that process for you?
At least getting a diagnosis was, at least you get a relief. Now you know what is disturbing you, what is going on. So there's an answer to it. So it was okay, despite the many medication which have so many side effects. Yes.
Which are?
Sometimes even that fatigue, feeling tired, you're moody. Some come like a disease.
Weight gain.
Yeah, weight gain, a lot of weight gain, weight loss. Yeah, they're quite a number.
Okay. Your stories are somehow different because for you, it came in when you're still a kid. For you, Kanja, when you are already an adult. How was it like after being told that you have lupus? How was that transition like?
I remember I'd gone for tests I used to go to my doctor is called Dr. Simani. I used to go to Dr. Simani's. I started going to his office at the end of July, it was, And now every week he'd order new tests. The first time I went there, I thought he would just ask me, "Oh, what's wrong with you?" and then maybe write some prescribe some medicines, and then I'd go home. But then I went. He ordered tests. Then the next week he ordered more tests. The next week more tests. Sijui some were going to India. So by the time he was telling me there are tests going to India, I knew there is something very wrong here. So I started obviously Googling. And then, so every time he'd order a test, I would Google. And remember the last test he ordered is called ENA. And then when I Googled, I got a list of the possible diseases he's looking for. There was lupus, there was Sjögren's, there was rheumatoid arthritis, there was fibromyalgia. All those are autoimmune diseases, yeah? When you Google each of those diseases, everything online it's like a death sentence. So I just knew if it's lupus, the next thing is probably my kidneys or my lungs, and the next thing is death. I knew if it's psoriasis, it's my skin, I'll be dead. So when I went to that...
You almost became a doctor from...
Oh,
Googling.
but I am. I dare say.
Yeah.
So that's when when I went for the last test, I was ready. I thought I was ready. And then, so I remember asking my doctor, "So, Doctor, are my results good or bad?" And he said, in the clinic, we don't have good results or bad results. And then he told me, actually, I don't actually have systemic lupus erythematosus. What I have is called...
In English, please.
But that's English.
Yeah.
What I have is called mixed connective tissue disorder, which is a combination of about five autoimmune conditions, but none of them really stands out. But for me, as time has progressed, I've discovered that the lupus has stood out more than the fibromyalgia and the Sjögren's and the rest of them. So when he told me, he showed me my results. And I remember, I was with my best friend, she's called Judy. I remember just breaking down and the secretary had to call me aside for a prayer session.
Wow.
Because I was ready for death. But let me just say, with awareness and with a support system, you can live a somewhat normal life.
Yeah. All right. Remember, in case you're just joining in, this is Doctors on Call coming to you live on Family TV, Family Radio 316. We are also streaming live on our social media platforms. And today, the focus is on lupus. Now, I'm sure there's so many questions. I can see SMS coming in on this particular condition. People are demanding answers. You will be responded to in a short while. But maybe to just back to you, Ashera. A while back, I did also a piece on lupus, and from this lady that I was interviewing, she says that she can get an infection at any given time. She even gave me a casing point where she got rained on, and she had just pulled a cuticle. Rain unfortunately went into that cuticle where she had pulled it out, and that was enough to give her an infection.
Yes.
She was actually hospitalized from that. Does it mean that if you have lupus, based on your experiences, you should be, I don't know, fragile or live in a certain ways? Are there limitations to things which you can do? I'll start with you, Washera, as I come to Kanji.
Yeah, lupus is an autoimmune condition, meaning the immunity fights the body. So your immunity is compromised, meaning you're prone to infections. So yeah, you have to take care. But you see now where we live, it's hard to, you have to be around people. You have to be around people. So it happens, you get infections. Like me, for instance, if I'm near someone who has a cold, within 2 days I'll get it. And it puts me down completely. Yeah.
Okay, and for you, is it any different?
No, it's pretty much the same. Okay, what happens with lupus? Your immunity is supposed to protect you against illnesses.
True.
Now, with lupus, something happens in your body such that the immunity starts attacking your normal cells. Your immunity goes on overdrive, yeah? So it starts attacking normal cells. So what happens is doctors give you corticosteroids and they give you immunosuppressants. It's English, eh? So when
I'm really trying to follow up, yeah.
when they give you those two medicines, now your immunity is reduced. You understand? When your immunity is reduced, now that means you're always prone to infections. That's why you're always prone to infections as a lupus patient. Another thing you need to understand is that lupus affects every single body organ. I mean the heart, I mean the lungs, I mean your kidneys, I mean
The brain.
the brain, I mean everything, your eyes. So already your organs are compromised. Already your organs are prone to. That's why you can get a UTI as a lupus patient and it becomes some complicated kidney something. Yeah.
So let me just understand, help me understand this, is you're taking medications
Yes.
to lower your
Your immunity is too
immunity,
high.
Yeah.
which is too high.
Yeah.
Then you're prone to infections.
Yeah.
Then how should you live your life? Because at the end of the day, you just want to live like any other person.
By the grace of God.
True.
Let me say by the grace of God.
Yeah.
Because now immunity goes lower. Like for instance, I was put on this medication, which is, it's good for the arthritis, the lupus, rheumatoid arthritis. But one of the side effects is your chest gets affected. So I ended up getting a chest infection. Yeah. So when it's cold, when it's dusty, I will end up with a chest infection, meaning that's antibiotics. Or maybe I get admitted and I'm put on IV antibiotics. So it's by the grace of God. Yeah.
So maybe you can just take us through your treatment. How has it been like? And is it something that's cheap? Because I can tell from
Oh God.
what I've heard.
Certainly not cheap.
Yeah.
So I don't know, like the medicine I take on a daily basis. What do you want exactly?
The treatment process, because I know it doesn't have a cure. And
It doesn't have a cure,
Yeah, you
yes.
have to learn how to manage it.
Yes.
Yeah.
Okay, for me, first of all, my lupus was diagnosed early. So I have not been through chemotherapy. I've not been to India. I just go to my doctor at Nairobi Hospital and, that's it. I've only been admitted once because of chest complications. So usually what happens, every lupus patient has one body part that is, for some people it's kidneys, for others it's a chest, for others it's a brain. I feel like there's a particular organ that it
Gets it more.
that gets affected more. So for me, usually I take HCQS. Should I name them?
Yeah, sure. Why not?
Okay, a steroid, an immunosuppressant, then I use an inhaler, and levodopa and terifilin. I would say per month, maybe my treatment would cost me something about 8,000. But that's because of the inhaler. Before the inhaler, it was like maybe 6,000.
Okay.
Yeah.
All right. And for you, sorry to bring this up, I noticed that you use crutches.
Yeah.
Is it as a result of lupus?
Yes, rheumatoid arthritis. For me, I also have MCTD, a combination of a number of conditions. So for me, it started with lupus. Then I was diagnosed with rheumatoid arthritis when I was 13. So the lupus kind of went down, then the rheumatoid came up. Rheumatoid now is known for deforming joints. So my left hip was badly damaged. I had it replaced in 2013. And unfortunately, they say dislocated in May. So I'm due to go for a revision surgery. Yes.
Okay.
Yes.
Yeah, because I know you guys are brave to just come on forth and share your experiences with lupus, which is hardly the case because there is always the stigma from the society,
Yeah.
or what will people say, what will people think. As far as this particular condition is concerned, have you had any incident with probably family relatives who don't really understand what the condition is?
For me, I would say my family has been more than supportive. For my family, nobody has ever orchestrated me for being sick. But maybe friends who don't understand, why is she walking slowly? Why is she always without energy? Why doesn't she want to do this or that or the other? But I don't think for my family, people have been 100% on board. But other people who don't understand what you're going through, people are ignorant in this society, as I've come to realize. People are very ignorant.
So do you always have to be in a position where you have to explain yourself over and over again?
Nowadays I don't bother. I mean, I'm just like, it gets to a point where you're like, if you understand me, fine. If you don't, you do your thing. Because I can't keep having to explain. I wouldn't be walking slowly because I want to, surely. So those who understand do, those who don't. But mostly I would say, I think with awareness, what we need to do is a lot of awareness. We need to, because one of the most deceiving things about lupus is that you look okay. Like when you look at me, do I look sick in any way?
Yeah.
You look okay. So it's hard for you to explain to someone that now you're sick. It just doesn't add up.
Okay.
But I think with awareness, we might get there.
But now for you, because I'm thinking it's something that you've had to live with ever since you're 11 years old. And also kids are quite inquisitive.
Yeah.
So how did you deal with that?
It was hard.
Yeah.
Because even me, I could not even understand what was happening to me.
On?
Yeah, so at one point I was very active. The next day I'm down. I remember there are times when my friends could not really understand, but I've taken the initiative to educate them about it. Yeah, and my family has been very, very supportive. Yeah.
All right. In most cases, you get to hear of witchcraft comes in between.
Yeah.
Being,
HIV.
yeah.
Oh, yes, and HIV. Yeah.
Was it
There are
the same?
times like, you get the infections and then the symptoms, especially when now the chest is concerned. So you go to the hospital and they're like, are you sure you're taking your ARVs? When was the last time you were tested? And this is the hospital. There's this one time I was admitted and I remember I had to take a nurse through what is lupus.
Really?
Yes.
The patient educating the
nurse.
The nurse.
Many times over.
Wow.
Yeah.
So how do you expect the nurse to treat you if they don't really understand what's happening?
Exactly.
Yeah.
It's sad that even the nurses cannot understand what lupus is.
Okay.
Yeah.
Now, with this awareness, what more can be done? Because I feel like focus has been on other conditions, and I don't see anything happening as far as lupus is concerned. In terms of awareness, how can guys get involved?
Wow.
A difficult question.
A very in terms of awareness, I feel like we have a Lupus Awareness Month, which is in May.
Okay.
We also have many lupus organizations, including the one that we are part of. Let's Fight Lupus, Kenya.
Fight Lupus, Kenya.
There is also Lupus Foundation of Kenya. There is also the one for Jane is called Kidney something.
Kidney Foundation.
Kidney Foundation.
Okay.
Yeah, but I think personally, I feel like people have to be individually interested, because we can force all this information down their throats, but it's upon them to take action. I mean, because I remember just like a few years ago in 2014, I had no idea what lupus is. My mother had no idea what lupus is, and I couldn't be bothered less with lupus patients. But when it affected me, that's when I took initiative and decided to find out as much as I can about this illness. So, what we can do, warriors themselves also need to, I feel like sometimes as warriors, we are afraid to say that we are sick. We're afraid to say that we suffer from a chronic illness. Like Washera has said, even some doctors don't know what lupus is. Because I remember there's a time I in my illness, I started having mouth sores, and then I was so dark and thin. Okay, I'm dark now, but like darker. And so people would say I have HIV. People think HIV is the biggest disease in this world, but it's not. So I think as warriors, we need to take that initiative on social media. Like if you meet people on the streets, I don't know, in your neighborhood, start small, start where you are, and just, because we can't, it's not the responsibility of these organizations to speak for us. We should speak for ourselves and let people know that this thing exists and we are alive. We are not dying in Kenyatta. We are trying to live our lives even with this condition.
True. I have a comment. Let me just read it, and you can share your comments on the same. This is on WhatsApp 0786 316 316. This person says, stigma is real, because even for this case, it's not even lupus, it's rheumatoid arthritis.
Yes.
And she says, I have been through a lot. My own family took off. I'm lucky my children are by my side. God help us. So stigma is real.
Yeah,
it's
it
not
is.
something that we're just making up from
Yes,
students.
it is.
Okay.
Yeah.
All right. So based on that, we're going to take a very short break. When we come back, we're still going to continue with this discussion as far as lupus is concerned. We'll be right back.
Research shows that a healthy diet is important in managing autoimmune disorders such as lupus. Here are recommended foods to help you manage the condition. Organic and unprocessed foods. Consuming foods in their natural and whole form limits your exposure to synthetic additives, toxins, or pesticides. Raw vegetables promote an alkaline environment in the body, which can help in lowering inflammation. Fresh fruits are high in vitamins and other important nutrients, which can be hard to get from other foods. Herbs and spices such as turmeric and ginger help relieve skin irritation and dryness.
Thank you so much for staying tuned to Doctors on Call. We're coming to you live on Family TV, Family Radio 316. We are also streaming on our Facebook pages. That's Family TV and Family Radio 316. The focus today is on lupus. I still have with me two amazing ladies. That's Washera Maina and Kanja, who are sharing their experiences as far as lupus is concerned. I'm getting a lot of feedback on the same. We're expecting also to join us shortly Dr. Eugene Genga. He's a rheumatologist, because I can see very technical questions right here coming through, but you can continue sending them. Once again, the SMS number is 22316 or WhatsApp 0786 316 316. Now to the both of you. Have you really taken time to try and understand what really might have caused this particular condition?
Personally, not really.
Mm-hmm. I can really anticipate her answer because she did a lot of Googling.
Yeah.
Yeah. Kanja?
I really have tried to determine what could have triggered this lupus thing.
Mm-hmm.
And for sure, I literally cannot come up with anything, because at that I was so fine. I was so okay. But what I feel in my research is that this thing has been in my family for a long time, because I remember back in 1998, my auntie started getting ill. Mm-hmm. She started losing weight. She started getting dark. She was thin. She was always sick. She was coughing. She was in pain. So obviously they thought she has HIV and AIDS. So my mother took her to hospital, And it's 98, so HIV is a big deal back then. So when she was taken to hospital, the doctors tested her, and they told her she doesn't have HIV, but she doesn't have cancer. They couldn't tell what is wrong with her. So my mother just told her to take her back home and wait for her death.
Wow.
Yes, and she died. And when I look back, she actually died in my room. I remember very clearly.
Sorry about that.
It's okay.
Yeah.
So I would say I've had it, but what triggered it is what I'm yet to determine. But maybe it could the month before my symptoms started, I had malaria. Maybe that is it. That is the only abnormal thing that happened to me at the time. But otherwise, I think it was just time, maybe. I don't know.
Okay. I can see a comment here. Somebody asking, is it contagious?
It is not.
Because I feel there are so many
It is
myths
not.
Wow.
We have to insist it's not.
You're so vocal about that.
I think that's what
The perception that...
And it's not sexually transmitted, by the way. I can't touch you and give you lupus.
You get lupus.
I can't kiss you and give you lupus. No. Like, we need to get that out of the way.
Yeah. Washara, what's the craziest myth you've ever had as far as lupus is concerned?
Witchcraft. It could be witchcraft. Yeah.
How did you tackle that?
Okay, at that time I was young, so I was like, now who is this person who could just bewitch me? What have I done to them? Sort of such questions. But getting to know God has really helped me along the way. So you just focus on not what caused it, but that God can heal you.
Okay.
Yeah.
All right. And what of the people, because I can see also a few people are asking whether it could be hereditary. Do you have probably any other person in your family who might be having this?
Not lupus, but rheumatoid arthritis. Yeah.
But is lupus, could it be hereditary?
Yeah, there's a possibility.
It does have a genetic aspect, yes.
Yes.
And also another thing that I'm seeing here, which I feel maybe you can respond to, is that lupus is a woman's disease.
80% of lupus sufferers are women. About 90%, actually,
90%.
according to research.
Okay.
Black women between the ages of 18 and 45. Who now that means it's women in their reproductive ages. But men get it as well. In our group, Let's Fight Lupus Kenya, we have about 3 or so men.
Yeah, three men.
Who also have lupus. So it's not a condition that is indemnified for the women, but women usually are the sufferers.
Yeah.
All right. So I will be taking another short break in a few minutes because I have a gentleman that I want to bring on set. But just before that, what will be your parting shots?
My parting shot to the patients.
As far as lupus is concerned and creating awareness also.
As far as lupus is concerned,
what would you want people to know about lupus?
Other than that it's not contagious, I want people to know that if you have lupus, it's not a death sentence. You're not dying tomorrow, you're not dying next week, you will live. I want to tell the ignorant in society, those people who think that we make these things up, we don't. It's an actual disease. And take your phone, go to Google with the MBs that you have, and just, type in Let's Fight Lupus Kenya or lupus, or even go to my Facebook page. I really am very vocal about it. And just, there's a lot of information out there. And stop stigmatizing people who are sick. And not only lupus, but all chronic conditions. There are so many, from the diabetes, from autoimmune diseases, the hypertension, all these things.
Okay.
Don't stigmatize people who are sick.
All right. And for you, Ashara?
I'd like to speak to maybe anyone out there who's suffering from maybe joint pains, extreme fatigue, and maybe you're treating it with painkillers, not knowing exactly what you're suffering from. It's good to go and get tested, because once you're tested early, as in once it's diagnosed early, there are chances that you'll not get to be so sick. Yeah.
All right.
Can I say something small?
Real briefly, yeah.
Very briefly.
Yeah.
This is to the people who are not sick, but there's something wrong with your body. You can tell. Like, are you tired? Do you have a joint pain? Are your eyes not? There's something wrong. Go to the doctor. Don't ignore that thing, because it could end up killing you.
Okay.
Yes.
All right. Thank you so much. Let me just read to you a few comments from Facebook before we take a short break. Mercy Commander, there is no situation which is big to God. May God have mercy on you guys. Kinyuwere Eliud, very brave. God is good all the time. God give them strength. Touching story, that's from Stephen Malala. Finally, I have Anna Musioka. She says, I stand with Lupus warriors.
Wow.
So
God bless
for
her.
Kanja
God bless her.
and Washera, thank you so much for sharing your story.
Thank you.
At this juncture, I really want to tell you that Doctors on Call, we are not wrapping up, because now we really want to get on the medical side and understand what exactly is this particular condition. How should one manage it from the medical angle? Because I'm also seeing a few questions here. People are asking for home remedies, whether they are viable. Well, these are questions that I don't have the answers to, but I have the right people to address them. So stay tuned. We'll be right back after this.
Research shows that a healthy diet is important in managing autoimmune disorders such as lupus. Here are recommended foods to help you manage the condition. Organic and unprocessed foods. Consuming foods in their natural and whole form limits your exposure to synthetic additives, toxins, or pesticides. Raw vegetables promote an alkaline environment in the body, which can help in lowering inflammation. Fresh fruits are high in vitamins and other important nutrients, which can be hard to get from other foods. Herbs and spices such as turmeric and ginger help relieve skin irritation and dryness.
Thank you so much for staying tuned to Doctors on Call, coming to you live on Family TV, Family Radio. We're also streaming on our Facebook page. And I can tell you for a fact, today there's a lot of activity on our Facebook platforms. That's our Family TV and Family Radio 316. We are also streaming from there. So earlier on, I got to hang out with Washera Minor and Kanja to just share a bit on lupus and their experiences on the same. Right about now, I want now to bring in the medical perspectives, because there are so many questions as far as this particular condition is concerned. What exactly is it? What causes it? How should you manage it? So I have two amazing guests with me right here in the studio. Perhaps they can introduce themselves. I can start with you, sir. Please, you can lean a bit forward. Yeah.
My name's Boniface Kalangili.
Okay.
I'm a co-founder of Fight Lupus Kenya.
All right. In a nutshell, what does the organization do?
Fight Lupus Kenya is a charity organization which supports people living with lupus.
All right.
And our main aim is to see people living with lupus can live a full life.
Okay.
That's our mission.
All right. Thank you so much for coming, for creating time and coming onto the show.
Thank you.
I also have Dr. Eugene Genga. Daktari, how are you doing?
Fine, thank you.
So what do you do as a doctor?
Okay, I'm a doctor by profession. I'm a rheumatologist. A lot of people don't know what a rheumatologist is, so maybe I can first start by explaining what a rheumatology is.
True.
There's a general doctor, and then after doing the general medicine, you go and do internal medicine, which is basically adult medicine, and then now you specialize in rheumatology. So some of the diseases in rheumatology you deal with are diseases which are autoimmune, which affect the joints, muscles, for example, things like gout, arthritis, rheumatoid arthritis, and also lupus.
Okay.
Yes.
One thing that has come out clearly from the first discussion is a lot of awareness still needs to be created. Is it because that people are ignorant, or what normally happens? Because also there are few myths as far as this particular condition is concerned.
The condition is not known out there. Yeah, I think basically that word needs to get out for people to know.
Okay.
And as Fight Lupus Kenya, we've taken that mantle to bring that word out to people. Taking into account that very many people are getting this kind of condition, and,
really?
It's not being mentioned everywhere.
Yeah.
It's not being known. It's
yeah,
not
because the
being
focus is
popularized.
only on the cancers, diabetes,
HIV.
you name it.
Yeah. So as a Fight Lupus Kenya, we saw it's good for us to be able to bring the word out there to people to understand. There is also this condition which also people are suffering and they need to know.
Okay.
Yeah.
Daktari, what exactly is this condition? And he has also mentioned that we are seeing more and more cases. Why is that?
I think the main reason why we're seeing a lot of more cases is that there's a lot of awareness now out there. For a long time, lupus was not thought to be a disease of this area, the tropics and Black Africa. Mm-hmm. It was more of a disease that was thought to be in the Western world. Mm-hmm. I think maybe it's partly due to the fact that we have a lot of malaria, HIV, TB. So a lot of emphasis has gone on that particular angle. But now we are beginning to, now that education and awareness is outside there, we're able to pick up lupus. Mm. So in a nutshell, what lupus is, lupus, the word lupus, the full name of the disease is called systemic lupus erythematosus. Systemic meaning multiple organs, erythematosus meaning red skin, and lupus is from a Latin word. The Latin word meaning wolf bite, because in the olden days it looked like wolf bites. Yeah, so in a nutshell, what it is that it's an autoimmune disease, meaning that there's something wrong with the immune system, such that now the immune cells which are supposed to be protecting you are seeing like you're a foreign body, and they're sending the white cells to attack it. And basically, in a nutshell, that's what it is.
Okay.
Yeah.
All right. Do you have the exact numbers, maybe from your organization, as far as this particular condition is concerned?
Maybe I can share how far and when did you start this organization. This organization started this year. Mm-hmm. And one of the key things which triggers us to start this organization, because we saw some guys who are suffering from it. And as we talk right now, in a group we have, which Washera and Kanja are in, we have like 300 patients there already. Mm-hmm. So we realized that this is something which needs attention, and that's how we started this organization. So one thing which has been happening in Kenya, there's no organized data about how many patients are suffering out there. Mm. And one of our key strategic goals is to try to look for guys to partner, and also to be able to organize that data so that we can be able to present it to potential people who can be able to support people living in this condition.
Okay.
Yeah.
Is it that this particular condition is very hard to diagnose? And what are some of the signs and symptoms that people can be on the lookout for, Dr.
Okay, so there's a part truth to that, because it's not a disease that is easy to find out, because the way it presents in a variety of fashions. And most of the time, sometimes you may find today you're treated for this particular condition, next time presents something different. So it usually takes a keen clinician to be able to put the pieces and dots together. Mm-hmm. So how they usually present is that the most common symptom is fatigue and fever. That's the most common symptoms. Followed by that, now, depending on the organs that are involved, is how it presents. Take, for example, if it affects the blood, you get low blood. If it affects your brain, you can get meningitis and the rest. If it affects the heart, you can get heart conduction issues and all that. It can also affect your muscles. It can affect your joints. So in terms of the diagnosis, there's a certain criteria which you normally use, and whereby you have to score 4 systems out of 11. If you have the 4 of them put together, it's when we're able to diagnose it as lupus. But like I said, sometimes the problem is today you may present with this and tomorrow that. And the issue with that is that it's very unfortunate some of the patients we see, today they're treated for typhoid, another is malaria, another is typhoid. Okay. And due to the alternating here and there, sometimes pick it up may become a challenge. Yeah. And
with misdiagnosis, now, what does it mean for the patient? Because, of course, they're not treating lupus, they're treating something else. So where does that leave the patient at?
It leaves the patient at a disadvantage, because lupus is best if you catch it early. The outcomes generally tend to be better. And the issue with lupus is that because the varied presentation and the complications that arise from it are very, very astronomical. Take, for example, like some patients already come in late stage when their kidneys are involved. And in the setting of an African setting, what the research shows that black Africans who have kidney disease have a poorer outcome. And that's the thing that we're getting. Sometimes they come very late. And by that time, they have already got a lot of issues going on, multiple systems are involved. So treating such a patient becomes a bit of a challenge. Yeah.
And I've seen that, for lack of a better word, this particular condition is somewhat complex. All right? And at times with doctors, they might not really be having enough time to break it down for the patient to understand that this is what you're having, this is how you should manage it. Now, from your organization, are you meeting this objective in terms of taking the patient through the steps in which she should go for as far as this particular condition is concerned?
Yeah, every month we are holding some counseling sessions whereby we meet with the patients and talk to them, bring somebody who can be able to talk to them about the condition. And also, we also share on how they can be able to manage this disease. But basically, each patient has a doctor who they see. And within the group, they can be able to say if one has been diagnosed very recently, can be able to be told which doctor to see and all that. Mm-hmm. But we are very much unfortunate because the doctors, the rheumatologists, as Dr. Eugene is saying, they are very few.
You think they're less than?
They're very few.
If I'm not wrong, in the whole country.
Yeah. So if and they are concentrated in the cities, in Nairobi,
Mm-hmm.
Mombasa. So it comes back to the mind that what happens to the guy who is out there in the village, who can only visit a health center. Yeah, so and that's the reason why we are coming in as an organization to be able to start bringing out the word and also to shout out there, and even the government can be able to see this is something which is serious, which needs to be taken into account, and and maybe they can train more rheumatologists.
Okay.
Thank you.
I'm seeing very many questions here asking whether it has a cure. I know for a fact it doesn't. So, Dr. How should you manage this particular condition? And also, let me just read to you a very interesting question here on 22316. Thank you for today's topic. I can relate to those ladies' experiences. I have managed to reduce lupus symptoms with diet. No dairy, no gluten, no grains diet. I thank God. So is it something that you can regulate through diet as you also take us through the management process?
Okay. I think I'll talk about the diet together with management. Mm-hmm. So like you rightfully said, there is no cure. So it's like a disease like diabetes or hypertension, which you live with it for the rest of your life.
Yeah.
So cure is two parts. There's one, to reduce the number of flares, and two, to induce remission. So remission basically is when the disease goes inactive and you don't actually have to take the medicine. So in terms of the flares, what are some of the causes of the flares? One, excessive UV light. Take, for example, you go to Mombasa and all that, can activate the lupus. Infections, especially, are very common. Things like urinary tract infections, chest infections. Other things like stress. This is a very interesting disease because stress can actually make it go up. Poor sleep can also do the same. Diet is something which is a bit controversial. What research has shown is that if you take a diet that is low in saturated fat, it may be able to ameliorate the symptoms. It doesn't necessarily treat, but it can actually reduce. And what we tell our patients that we are not supposed to just maintain the diet. We should combine it with the usual medicine. And some of the medicines that we give, because this disease is where the immune system is overactive, is to try and suppress the immune system. So some of the drugs we use are things like azathioprine, hydroxychloroquine. Sometimes we give steroids to such patients. And we tend to see very good results for some of these patients that do well on this medicine.
Okay. Let me just also read you another feedback as far as that is concerned. This is coming from Nicole. Nicole on WhatsApp. I'm trying to feed myself with natural food, drinking ginger, green tea, vegetables, olive oil, and I'm still on medication. She says I'm doing a bit okay since I'm eating natural food. Does it mean that you should be restricted on that? Let's say things like processed foods are no-goes on. Maybe you can respond to that.
That's actually true because most of these refined foods have a lot of fatty acids and the rest. So we tend to tell our patients to eat food that is low in saturated fat. So dry food things like refined foods you should reduce. Red meats are also not good. You tend to favor the white meats. If you're cooking food, try to take shallow fat or dry fat, avoiding things like chips that have a lot of oily stuff, because they tend to generally cause flares of this particular disease. Yeah.
All right. I'm going to ask you a technical question. I know Fight Lupus Kenya is only a few months old, but how are you working with the government? Because as it is right now, I can only say probably you are centered around Nairobi, but I believe there are people in other counties who experience the same and they don't have avenues to get help. But now for you guys, you are here in Nairobi. The government is a phone call away. Yeah. So are we looking at any initiative that you're driving towards the government to further your cause?
Yeah, we have those plans to go to the government doors and be able to knock. But as a new organization, the first thing which comes in mind is about the structures. So the first thing we did is to come up with a strategic plan for the organization, which is supposed to run for 5 years.
Okay.
So in the strategic plan, there were key things which we are supposed to look at. One of the key things is creating awareness. The other thing is about trying to support the cases of people living with lupus, the vulnerable cases. Because the medication are a bit higher, so we got a target of that. The other thing is about we also want to form partnerships, and that's where the government comes in, and that's our focus, to form partnership with organizations which have the same mission with us, and also bring on board the government bodies which can be able to support in this cause. And I'm happy to report that we've been able to successfully see many organizations getting into this cause. And we successfully formed a partnership with an organization called KEFWA, Kenya Welfare for Footballers Association of Kenya. I think I got it right. Yeah. And through KEFWA, we say that we focus on creating awareness first. And we said we can create awareness through football first to see how this goes. And yesterday we had a soccer tournament for Lupus Awareness Soccer Tournament, which was a 7-a-side, and we saw 24 teams participating.
Oh.
Yeah, so meaning that the word is also going out there. And in total, we had able to play around 79 games. Oh. And many organizations were represented. Karen Hospital was also represented. Mata Hospital was also represented. Oil Libya. We had many organizations.
So now also the condition itself.
Yeah, so the word shows that it's going out there, and that's the starting point.
All right.
Yeah, good.
I have a comment from Rose. Rose says, "Hi, good show on lupus. Was diagnosed in 2015 after being on and off hospital severally previously with no answers. 2015 was tough medically. Was admitted in hospital 6 times within 1 year." And she goes ahead to say, she also has side effects from medication, e.g., abrupt weight gain, high blood pressure. Let me get this right. Thrombocytopenia. And during cold weather, the pain was unbearable. Yeah, she still takes in medicine, but not as much before. So how do you deal with these side effects? And are they the same on all the patients?
Okay, but when we diagnose our patients with lupus, we usually tell our patients that there is no perfect drug. That's the first thing. And that there are risks and benefits. In the setting of certain drugs, take for example steroids. Steroids were a wonder drug. When they came in the 1930s and 40s, there was a lot of hullabaloo and very excitement about it. But over time, we came to learn that it does have some complications. Take for example like the weight gain, high blood pressure. So what the current treatment strategy is, especially on lupus from the world authorities, is that we're going towards steroid-sparing medicine. So we're trying to reduce the amount of steroids, and thereby using other medicines like the hydroxychloroquine, the azothioprines, other medicines that will have less side effects. About the coldness of the hands, that is actually one of the symptoms of lupus. We call it Raynaud's phenomenon. So basically the science is that during cold weather, the blood vessels become very thin. And they become thin, the hand becomes white, pale. And then as the blood keeps coming back now to reperfuse the hands and everything, causes now the pain and everything. So that is probably one of the symptoms of lupus, yeah.
Okay, or maybe still on that, there are a few myths that came up. Number one, that were shunned down by Team Kanji and Oshara. They were along the lines of if it's contagious, and then it's a woman disease. And then the last one, women with lupus should not get pregnant due to an increased risk of birth defects. What are your responses on this?
Okay, those are some of the comments we get.
Really?
Yeah, as doctors, as doctors, you have to have the compassionate side, and you have to be very attentive, because those are some of the comments we get. One, they can get pregnant. That is the first thing. The only issue is that if you're not on the right medicines, you can get recurrent abortions, not actually the deformities. And the recurrent abortion is very unfortunate. I remember, I saw a lady a couple of weeks ago in Kenyatta. She had about 6 abortions before we diagnosed with lupus, which is very unfortunate, because losing a baby is very, very traumatizing. About the birth defects, that there are certain antibodies which, if the patient has during pregnancies, can predispose to getting a form of a baby lupus, in quotes. And usually when you have those antibodies, there are medicines that we give to try and reduce the risk for getting that particular complication. The first question you asked, is it contagious? No, it's not contagious. The way it works is that you must have a genetic susceptibility, meaning that your genes are already defective. So what happens is that as your genes are defective, you need a trigger. And the trigger is what we don't know. Some of the thoughts we have is that UV light, but the question would be, why would this guy get, the other person wouldn't get? Other triggers which people are thinking about are things like viral infections. But as you can see, there's still a lot of theories out there. Another question, another comment you made said, is not a woman's disease. I wouldn't say it's a woman's disease, even though it's more common in women. Like the ratio is about 10 to 1. But I think it's just a disease for everyone. Categorizing as a woman's disease is a bit, I don't know. Yeah.
All right, I'm seeing time has really caught up with us. I really wish we could have a bit more time to delve deeper into this particular condition. But I'm going to give you, sir, a chance for your final sentiments as far as creating awareness is concerned on lupus.
Thank you very much. I will ask for organizations out there, and also for people out there, to know that lupus is here with us, and to come on board and create awareness and talk about this disease, so that people can be able to get to know the disease and manage it. As the lady said, it's not a death sentence.
True.
Yeah, so people need to know about it and be able to manage it. Thank you.
And the government to be a bit more involved.
Yeah, the government.
This cause.
Yeah, exactly. The government to come on board and further this cause.
All right.
Like the way they are doing in cancer, HIV, and other aspects.
All right. And for you, Dr. Eugene?
As a parting shot, there have been very many famous people with the lupus. I'll give you, for example, Michael Jackson had lupus. Really? Yeah. There's a singer called Seal. For those who know Seal, he has some scars here. He had lupus. Toni Braxton, for the girls who know the secular, she's a secular singer. She has lupus. Selena Gomez has lupus. In fact, she underwent kidney transplant for her lupus. So lupus is there, and it's not a death sentence. The major issue with lupus is that the medicines are very expensive. And I think it's unfair that the government is only concentrating so much on HIV, on HIV, cancer, and the rest. But this particular disease can predispose you to cancer. This disease is also common in HIV. So either way, we are still interconnected. And I think the government should step in there and help. And for the patients who have lupus, that lupus isn't a death sentence. I know the one thing which frustrates me as a doctor is that when patients come, they have been labeled as lazy. It's just because of the disease. There's a lot of fatigue and everything, and they've really suffered. And I think patient organizations, what they're doing is actually a very good thing, because keeping them together, having someone to talk to is a good thing. Like in the West, what they have done is that from the patient support groups, they've been able to push the government. And when they push the government, they've been able to get cheaper drugs. Sometimes some of them are very free for the patient, and they've been able to improve outcome for these particular patients.
All right.
Yeah.
All right. So, Dr. Eugene and Boniface, thank you so much for coming on to the show. I believe from watching this or even listening, being that we're also live on radio, people now at least are better placed as far as lupus is concerned. Let me just read a comment from Leonard. He says, stigma is real, good job at raising awareness and sensitization. So thank you, gentlemen, for furthering that cause. And I also want to thank my guests who are on the show earlier on. That's Kanja and Washera. Thank you so much, guys, for sharing your story. And I forgot to read this. It's from Liz. It says, I've known Washera for the past 20 years. She's one strong girl. She's been through a lot, but her positive attitude and faith in God has carried her this far. Liz, thank you so much for that particular comment. And for everyone who got involved in today's edition of Doctors on Call. The reason why we do this every Sunday is to create awareness, because we believe information is power as far as your health is concerned. I also do say this show is always about you. So tell us who you want to see on the show next Sunday, and we'll work towards that. My name is George Oraro. See you next week, same time, same place. Have a good evening.
Tomorrow on Youth on the Move.